Hi everyone, welcome back. So today I'm going to be talking about hypertension or high blood pressure because it's actually, even when people train as massage therapists, we're taught that high blood pressure is a complete contraindication to massage. But actually, that's not entirely the case. And certainly there is research that shows that massage is actually very beneficial for those with either pre-hypertension or hypertension. There are still some circumstances, where it will still be contraindicated, which I'm going to go on to talk about. But certainly, I wanted to do this post just to show those of you out there that do have high blood pressure that, that doesn't necessarily mean that you can't get a massage treatment. So, if we think about sort of how common high blood pressure is, it tends to affect around 1 in 4 adults in the UK. Approximately 31% of men and 26% of women tend to be affected with this. And it most commonly affects those over 65 years old, but certainly, it can affect those, in younger age groups. And approximately 20% of hypertensives are actually unaware that they even have high blood pressure. There are around 71% of those with high blood pressure who are actually on medication for it. But of those 71%, only around 48% actually know whether or not their blood pressure is being controlled. And that's probably because they get prescribed medication, they keep taking it every day, but they don't actually go back to their GP for their blood pressure checks. So, it's important to also look at other factors, lifestyle factors that can affect blood pressure. Obviously there can be a genetic factor. If you've got family history with heart problems and things like that, you're going to be, more at risk of getting high blood pressure. But certainly other lifestyle factors, things like smoking, excessive alcohol intake, diet, lack of exercise, if you're overweight, all of these things are going to contribute towards high blood pressure. And there's also been, it's been found that there is definitely a link between diabetics and high blood pressure also. So the problem is, in terms of sort of getting diagnosed and knowing that you have this, hypertension doesn't really have any visible symptoms. But of course we know, it increases the risk of heart disease and stroke, which are leading causes of death. So if you have a family history of these things, it is important to, get your blood pressure checked. Heart disease, whether it be clogging of the arteries, heart failure, heart attacks, all of these things also increase the risk of a stroke. These things, account for about 27% of deaths in the UK. So, that's over a quarter of deaths, which amounts to approximately 170,000 per year. So this really is, a big problem in the UK and in other countries. So, if you can find a way to sort of regulate your blood pressure, which may mean that you might, be able to reduce the medication, obviously that's why wouldn't you do it? So first off, I'm going to sort of talk a little bit about what actually is blood pressure, because everyone's heard of blood pressure, and they sort of often know roughly the numbers, whether it's high for them, but quite often people don't actually know what blood pressure is, or what those two numbers that you get in your reading. For example, your blood pressure might be 120/80. A lot of people don't actually know what each of those numbers mean. So I'm going to talk about that now. Okay, so if we think about blood pressure, we need to look at the heart and the vena cava and the aorta. So obviously we have, when blood has gone all the way around the system, it becomes deoxygenated and it gets transported up towards the heart, gets pumped through and around through the lungs to become oxygenated again, and then back out to all the other, through the capillaries and the smaller blood vessels to take oxygen and nutrients to the other organs in the body. Now, when the heart beats, it basically pumps blood into the arteries, at which point, the blood pressure, which is basically the force of that blood pushing against the walls of the arteries, that blood pressure is at its peak as that blood is being pumped into the arteries. And so that first part, as it gets pumped out from the heart into the arteries, that is where your systolic blood pressure is red. So the systolic blood pressure is the top number. So if your blood pressure was 120/80, your systolic pressure is 120 millimoles of mercury. And that represents the pressure, in those arteries as it's being pumped out of the heart. And then when the heart rests between heartbeats, that pressure on those walls will fall. And so that's known as the diastolic pressure. So once it's been pumped out of the heart, which gives us the systolic, the pressure then falls, and that gives us the diastolic pressure, which in a blood pressure of 120/80, the diastolic would be the 80 millimoles of mercury. And that's when, at that point between heartbeats. So now obviously everyone's, an individual, what is normal for each person will vary according to all those things like age and activity level, family history, any other medical issues or medications, and lots of things like that. So, if we think about a textbook blood pressure, you are looking at something around 120/80 for your average adult. However, we find as you sort of get over 50, the blood pressure does tend to increase a little bit anyway. But, that's not to say that, for everyone, if their blood pressure is higher than 120/80, it's not necessarily a bad thing. You have to look at the whole picture and look at their lifestyle and, medical history and all the rest of it. It could be that you have like a 30-year-old man who, goes to the gym every day, is very fit, very healthy, but their normal blood pressure may well be, 135/85. And there's nothing wrong with that. That's the norm for them. So that obviously has to be taken into account when you get blood pressure checks. You have to kind of compare it to what's normal for you. But generally speaking, we would consider someone to be hypertensive when their blood pressure is consistently higher than about 140 over 90. And if it's consistently higher than that, then, we start to kind of look at their lifestyle more, and think about the possibility of medicating that person. So, in terms of sort of massage therapists, what are the implications for a massage therapist in treating a hypertensive client? Well, any reputable massage therapist, will take accountability for their own practice, just in the same way as a nurse or a midwife or, any other kind of healthcare professional. And, we use information from research and also, information from the clients themselves in order to make educated decisions about what treatment is right for them, whether they should receive a massage or not, and what techniques we should be using, etc. So, this is where seeing a registered therapist is really, really important, and particularly with hypertension, you do want to ensure that you are seeing a registered therapist and someone who is qualified and experienced in dealing with this issue. And so that's why, as massage therapists, I sometimes get told that my sort of consultation form is very sort of in depth in terms of the sort of medical questionnaire part. And I suppose part of that is just having been a nurse, and I'm sort of a bit more cautious. But I also know the risks a lot more. So yeah, definitely, make sure that you see someone who's registered and experienced. Now, while, as I say, there is research that demonstrates how massage can help reduce the blood pressure, as I say, therapists are told during their training that high blood pressure is just a complete contraindication. Now, high blood pressure basically means that the pressure exerted on the walls of the blood vessel is increased. So any extra activity that may further increase that intravascular pressure carries the risk of potentially rupturing a blood vessel. And this, of course, could be fatal because it can cause a heart attack. Now, massage is well known. If you've watched my videos, I'm always talking about how massage can help enhance the circulatory system. Massage is well known for that. Basically, and it, by pushing any stagnant blood through the system, which, in turn will flood the blood vessels with fresh blood, because once that old sort of stagnant blood that's just sitting around, once that's pushed through, it allows a lot more room for new blood to really, come through to supply, the rest of the body with oxygen and nutrients. However, so sort of from that point of view, we think, okay, well, the increased circulation, if the blood pressure is already high, to then improve the circulation to the point where you've got that sort of sudden rush of blood coming through the vessel, that's just going to increase the pressure further, right? But this is where the research comes in, and this is what a lot of therapists don't actually understand, is that, the research has actually shown that massage can reduce blood pressure, and it does this by stimulating the receptors that tell the central nervous system that the body is relaxed. And this causes vasodilation of the blood vessels. So, which means that the blood vessels then open up. Now, if the blood vessels are opening up, that's actually going to reduce the pressure on the walls of those blood vessels, and also consequently reduce the heart rate. So in this way, massage also, that kind of counteracts that sort of rush of, fresh blood moving through the vessels. So actually, the risk then isn't really sort of any higher. Now, if we talk about the benefits of massage, and there are just some circumstances where there is still a risk, which I'm going to go on to talk about. But firstly, I want to just talk about the benefits of massage for the hypertensive client. So, as we said, while massage may increase blood circulation, which you would think, would increase the pressure on the blood vessel walls, it will also cause vasodilation, which is where the blood vessels open up, which reduces the pressure on those vessels and reduces tension and consequently reduces blood pressure. The risk of increased circulation is really generally only an issue when either the blood pressure is not controlled, or sort of if there is a sort of extensive medical history. And so in these situations, a doctor's consent would really be required before proceeding with treatment, just to ensure that the blood pressure is actually stable and being controlled. Again, going back to those lifestyle factors, while reducing smoking and alcohol intake, increasing regular exercise, making dietary changes, these things may help blood pressure, to reduce. But actually, one of the biggest factors in terms of blood pressure, increasing is stress. And, that is such a common issue to, so many people. And, we know the benefits of massage for stress, in releasing those endorphins, reducing the secretion of those stress hormones. And so massage can therefore, relieve that stress that's causing the blood pressure to go up. So that's another really good reason, why a hypertensive should have massages. Hypertension is generally treated with antihypertensive medication, but this can sometimes involve prescription of a few different drugs in order to achieve an acceptable blood pressure. And sometimes, this additional medication may be to combat side effects of the initial medication to help the blood pressure. And a lot of people don't want to be on numerous medications. But, the chances are, obviously we never sort of guarantee anything, but there's a very good chance that with regular massage to work on those stress levels, etc., and sometimes along with lifestyle changes, massage used alongside just that single medication, may be enough to manage the blood pressure and keep it at a controlled level, and therefore reducing the need for these extra medications, that are basically there to, relieve the side effects. So, if it means less prescriptions, then again, that's got to be a good thing. So what does the research show? It shows that massage reduced a sitting diastolic and systolic blood pressure, in addition to reducing those, stress hormone levels, so things like your cortisol and your norepinephrine, and also reduced anxiety and depression. Also, it shows that regular massage treatments lowered blood pressure in those with clinically diagnosed hypertension. If we look at the types of massage that is good for hypertensives, Swedish massage, has certainly been shown to have the greatest effect in reducing blood pressure. And of course, Swedish massage is the one that is known particularly for reducing those stress levels. Whereas, potentially sort of painful treatments, so things like your sports massage and your trigger point therapy, could potentially have the opposite effect, because clients may, if it's too uncomfortable, may find those treatments quite stressful. So although, other research does actually, look into the effects of myofascial release and trigger point massage therapy, and does show a significant decrease in both diastolic and systolic blood pressure, as well as reduced muscular tension and heart rate. I would say, despite this, the general view would be that if you are going to have a massage treatment as hypertensive, that Swedish is the best way to go. Now, there was also some research done on anaesthetized rats, which showed that massage to the front and sides of the abdomen actually reduced arterial blood pressure. So it's been suggested that the same can be said for humans. That if we are massaging all along the back of a hypertensive client, that this could result in decreased cardiac output and therefore reduced blood pressure. So I'm going to talk a little bit about precautions that a massage therapist should take if they have a client who requests treatment that is hypertensive. So basically, should a therapist treat a hypertensive client, given that there is conflicting information between the research and between what we learn in our training. So basically, if the client's high blood pressure isn't controlled, then treatment shouldn't go ahead unless there is an agreement from the GP. Appropriate massage modalities should be used to encourage relaxation, and so therefore Swedish massage is really the type of massage that should be used. Therapists, should not be treating hypertensive clients unless they've had a higher level of training with more in-depth knowledge of the anatomy and physiology, and understanding of the complications that can arise, and experience of dealing with hypertensive clients. So, and by this sort of standard, the therapist should also be registered. So in conclusion then, use of stress-reducing alternative therapies to prevent and or treat hypertension will be most successful when carried out alongside those lifestyle changes, so increased exercise, a healthier diet, reduce or cut out your smoking, reduce your alcohol intake, and dealing obviously with stress. When clients are in a continued state of stress, so particularly something like with PTSD, where there is just a continued stress response happening in the body, that continuous release of stress hormones due to the sympathetic nervous system will eventually cause a rise in the blood pressure. So by stimulating the parasympathetic nervous system, massage can restore the sort of homeostasis, including the blood pressure, via physiological changes to the vascular, muscular, and nervous systems. And Swedish massage is very good at doing that. While benefits have been noted, research showing massage to be effective in lowering blood pressure is somewhat limited. And in cases where hypertension has, introduced heart disease or strokes already, then certainly in those clients, the contraindication to massage treatments will still stand. But for clients in the pre-hypertensive state or who are hypertensive, but it's controlled and they don't have that additional cardiac or vascular issues, massage may actually be the difference between reducing stress levels and helping to prevent further health issues and developing heart disease. Which, as we said at the beginning of this video, is one of the leading causes of death in the UK. Massage may also reduce the need for those additional medications. So, it really can be quite beneficial. But as I say, do see a registered therapist and do be honest about your medical history. So that's really it for massage in the hypertensive client. As always, there will be more videos coming up, so do subscribe to my channel. You'll be informed when they come out and you'll be able to see all of my other numerous videos that have gone up already. Feel free to comment down below, or you can message me through my Instagram and Facebook pages and I will answer you. But for now, that is really all from me. So I will see you next time. So take care. Bye.